All right. Good afternoon, everyone, and welcome to our webinar titled Crisis Ready, Using Telehealth to Support Health Centers and Schools During Climate Emergencies. My name is Gone Job, Senior Program Manager with the School-Based Health Alliance, and I am joined today by my colleague, Johnny Grigo, and our amazing presenters, Brian and Kathy. We are so thankful to have you all with us today. We have an exciting hour of great content. And with that, I will turn it over to Donnie.
Thank you so much, Gone. And I just wanted to make a note to everyone now beforehand that this session is being recorded and that the recording, along with the slides, will be posted on our website in addition to email follow-up. All right, let's get us started. So some of you might know, but some of you might not be familiar with the School-Based Health Alliance. So again, I'm Donnie Greco. I work for the School-Based Health Alliance, and we're a national organization that works to support and advance school-based healthcare. So we do this through policy work. We offer standards for those in the field. We do data collection, and we provide training, technical assistance, and consultation to support school-based health centers from the planning stage all the way up to and through the expansion improvement stages. So we do a lot of work, and we're really happy to help support this webinar today. So before I kind of move on to the learning objectives, I just want to kind of review some housekeeping reminders. So you can hear us, but we cannot hear you. You can use the Q&A icon at the bottom of your screen to ask any questions. We have a dedicated portion at the end of this session where we'll take all the questions. Goni and I will go through and we'll make sure to respond to them. So please post those questions, but make sure you're hitting that Q&A button and typing them in there. If you wish to have closed captioning turned on, there should be a button at the bottom of your screen that might either say CC or closed captioning, depending on which version of Zoom that you're using. We will also have a set of evaluation questions at the end of the webinar, and I really encourage you to please complete these, especially the first three, to the best of your abilities, because this helps us best provide content for all of you and tailor it to the voices in the field. So with that, let's move on to today's learning objectives. So our hopes are that all of you and participants will be able to, after today's session, recognize the essential tools and steps necessary to establish a mobile telehealth clinic in response to climate-related disasters, understand communication strategies to maintain healthcare services when traditional infrastructure is compromised, identify methods for building strong collaborative relationships with schools and community agencies, and integrating telehealth into emergency response structures. So as Goni mentioned, we have two wonderful speakers today. They have a lot of amazing content, and I'm actually going to turn it over to both of them so they can.
All right, well, thank you. I'm Kathy Wibberly. I'm director of the Mid-Atlantic Telehealth Resource Center. We are one of the 14 telehealth resource centers funded by HRSA to provide technical assistance and training around all things telehealth. And I am going to be tag teaming with my colleague, Brian Gannell.
Hi, and I'm Brian Gannell. I'm one of the senior engineers with the Office of Telemedicine at University of Virginia. I've been with them for about 15 years. I do a lot of focusing on isolation communication and community event support. And so we look forward to talking to you guys today about being prepared during a climate emergency.
Right. So we're going to be talking about using telehealth to support health centers and schools during climate emergencies. And this will be followed up by another webinar that's going to be really looking at more infectious disease. So there'll be all sorts of emergencies that we'll be addressing in these upcoming webinars. So in the next slide, just to give you a sense of what we're talking about when we talk about climate-related emergencies, it is everything from in the past year, we have had drought, we have had excessive heat warnings, we have had tornadoes, we've had wildfires. And on the next slide, as you all know very well right now, we are still recovering from hurricanes. And so between Helene and Milton, and there will probably be more before the hurricane season completely comes to an end, we definitely have seen these types of emergencies become not only more frequent, but more severe. And so this webinar is really going to see how we take some of these telehealth tools and apply them to these emergency situations. So on the next slide, what we have is starting off with two polls. So the first poll is, what types of climate-related emergencies have you experienced? And this question is for you personally. Not necessarily related to your work, but have you been in a flood situation? Have you been in a hurricane or tornado? Have you been in a drought? So just go ahead and answer those questions real quickly. Give you a few seconds. And let's go ahead and flip to responses. All right, so quite a significant number of you, 45%, have actually experienced being involved in a hurricane or tornado, which is pretty significant. Extreme heat and heat waves, I think we're all definitely experiencing more and more of that. There are a bunch of others, and I am curious if you want to put in the chat what those others are. I'd love to know. All right, let's take a look at poll question 2, and this is specifically related to your work, whether you are in schools, in a health system or a health clinic. Have you ever assisted with the emergency response and recovery efforts in your community? And that's simply yes or no. All right, and let's flip to the responses. Okay, quite a few of you actually have said yes. That's more than I would have thought. So 39% of you have actually assisted in some way in response efforts. The rest of you have not. All right, that's great to know. And we will try to hit on maybe some of the more basic stuff for those of you who've never been a part of a response team, and then give you a little bit of a deeper dive for those of you who have been part of that. So next slide. As we get started, I just wanted to point you to a previous webinar that we had done just a few months ago on emergency preparedness and school-based telehealth. This was a broad sweep overview of kind of FEMA's comprehensive preparedness guide and what our different roles are. And so what we're going to be focusing on today is more on that developing the plan piece. But I want to help kind of guide you back one step, in that one of the things that we talked about in the previous webinar was that if you are in a health clinic, or even if you're in a school, you really need to determine your goals and objectives prior to an emergency, so that you're not just, running around like a chicken without a head, trying to figure out what you're supposed to be doing. And what I mean by that is, if you're a clinic setting, is your main goal during an emergency to make sure that there's continuity of care for your own patients? You're not there to assist everyone else in the community. Or is your goal to be kind of the go-to resource for anyone who's having a crisis as a result of the emergency? Or is your goal really to deal with just the mental health needs? So really defining those goals will help you with the development of the plan. And so from now, I'm going to punt to Brian to really talk about some of the nitty-gritty pieces of the actual planning.
Great, thank you very much. So you can go ahead to the next slide. So one of the areas, I work at University of Virginia, and I've helped a lot with some of the event support and some of the other things that have happened in our community. And one of the things that I think comes to the forefront very quick is the importance of that communication plan to be in place. And so that one is identifying the community partners that you're going to be working with, and so that you have an organized manner to sort of communicate with those folks out in the community, as well as having the command structure in place to run and manage that communication as it happens. If you wait until the time of an emergency to try to put this in place, it's going to be too late, and you're not going to have the resources that you need to basically communicate. And this could be all kinds of partners that are involved. If we're looking at this from a school perspective, as far as a communication plan, you have to communicate with your students and the families that you're associated with, as well as the partner organizations in the area that you may end up working with. And if that's hospitals, fire departments, police agencies, and ways that you're organizing. And so just making sure that you have this in play as you move forwards and getting ready for the emergency, and not waiting to the 11th hour. Having a clear plan of how you're going to communicate with the different entities. And so whatever platform that is that's going to be used in those cross-agency communications, and making sure that it has been tested and vetted prior to the emergency and in place, so that you have a means of actually communicating and working together within the community. So you can go ahead to the next slide. So some of the use cases that we see that potentially could be used during an event for triage and initial assessment, mental health support, chronic disease management, remote diagnosis, infectious disease management, post-disaster follow-up care, specialty consultations, and then continuity of care for displaced individuals. But all of this, again, has to be ready and in place prior to going into the emergency. If the emergency has happened, a lot of times it's very difficult to get the technology in place. Specifically, if you're trying to follow for continuity of care, you may have to place devices in the field with those particular patients prior to an event to make sure that you have a means to connect with them. Further, what I would say is that potentially a school could be a location that a lot of these different encounters may happen during an event. The school may be one of the few resources that may be maintained within a community and could be a resource that a lot of these sources come to do these different types of clinics. So you can go ahead to the next slide. So one of the biggest things that we've started to hear around the happening down in North Carolina and with some of the different hurricanes and things that we've seen is the connectivity during a disaster is a major issue. And I think there were 19 cell towers identified that have been down in the Asheville area after the incident. And so sometimes it's very complicated to maintain connectivity. And so one of the things that we really focus on is being sure we're ready for those connections prior to the event, whether that's using something like AT&T FirstNet or Verizon Frontline. Both of those are both emergency responder services that do allow more throughput and dedicated throughput for emergency responders. So having systems like that in place. If the cell towers and none of that's available, leaning into things like Starlink. They have several different services now, and it's a low orbit satellite service that offers broadband in areas when a lot of the infrastructure is down. And they've provided quite a few resources in areas like Asheville and the area communities. One other thing to note is a lot of the cell phone companies in these days, and both iPhones and Android have added a functionality that can be used during some of these events. If all of the cell towers are down, they've actually added some 911 SOS capabilities. So typically most of the phones now, even if they have no cell capability, they can engage the satellite network. So if you see across the top of the phone, it's an SOS mode, you still have a line of communication to some of the emergency professionals in your community. So you can go ahead to the next slide. So some of the things that you need to be thinking about as you go into this, again, you have to have a lot of this stuff in hand prior to the emergency. And it's stuff we think about like laptops and computers and tablets, smartphones that could be used for remote consultations, that high-speed internet that we spoke about, whether that's satellite, Starlink, or mobile hotspots, making sure you have those accounts and things in play. Webcams and cameras that can be used with the laptop so that you can have those kind of face-to-face encounters. Noise canceling headphones. So if you're in an area where there's more than one person, that you can have that privacy and those private conversations with the patients and providers. Video conferencing software like Zoom, Skype, and specific telehealth platforms. The microphones that need to be attached to these machines. A lot of times the microphones are built into the webcams, but sometimes we need more robust solutions for rooms that are a little more complex. A power supply and backup, and we'll talk more about that because I think between the internet and the power backups for some of these types of solutions, these are some of the most complicated things to make sure that you have in place prior to the event. Portable diagnostic devices that you may use in the field, and whether that's Bluetooth enabled stethoscopes, otoscopes, blood pressure cuffs, making sure you have those things ready and tested prior to an event. And then any sort of remote patient monitoring devices that you may have out there and deployed. So having all of that hardware in place prior to the actual event is crucial, and not waiting to the 11th hour to sort of get this stuff in play. And you can go ahead to the next slide. And so as we start to think through operationalizing during an event, like what we may have to do, I think some of the key considerations that we've sort of hinted on already is the internet and power resilience. You have to plan for this infrastructure because those can be very heavily impacted when you go to set up. So you have to be ready for alternative sources. And that's the things that we've talked about the satellite internet. One of the things for us at UVA, we do a lot of support in the community around events. And we've had a couple of large events around us, a concert event south of Charlottesville that we've done support for several years. And one of the things that we've done to support those is working with the cell providers, and they were able to bring in a temporary basically a trailer that was a temporary satellite, or a temporary antenna for them to basically be able to broadcast Verizon services. And so working with your partners in the different companies to potentially provide temporary locations to broadcast those services as one solution, and being set up in advance and having those relationships in place to call the AT&T folks and have them potentially bring in connectivity. The other thing is accessibility during this, because it's very easy to focus on some of these higher end technologies. And we need to make sure as we're starting to operationalize this, that we're not isolating anybody and we're making this available for the vulnerable populations. So we have to have a clear plan that does incorporate everybody within our community and ways to access this to make sure we're not leaving anybody behind, as well as going so far as to focus on the non-speaking people in our communities that may be out there. The scalability of that system is of great importance. If you don't have a system that can be scaled up to support the needs of the community, so that's something that you really have to think about as you're deploying it in advance to make sure it has capacity. And if you need to scale it up to a larger implementation, that you do have that ability. So you can go ahead to the next slide. So I think really as we break this down into phases, you've got that initial planning and assessment phase. It's really to evaluate the extent of the disaster and who is affected in your area. Are all the areas of your community impacted? Is it just certain spaces? And where will you be trying to deliver those services? You have to identify healthcare providers, technology platforms, and support needed, and as well obtain the regulatory and legal approval. Some of the things that are happening down in North Carolina, one of our partner organizations has been working to get volunteers down into North Carolina, and they have a website right now for medical professionals to go sign up and pick up shifts. And one of the things noted as you're sort of filling that out, they ask actually to make sure that you have your license available. And I think you have to submit a copy of your license whenever you go to submit for a shift, but they've actually done a framework to make it available for people to volunteer and to get their licensing and everything in front of them so that they can volunteer for medical shifts. So making sure you have a plan to get help into your area to help triage and work through, I think, is of great importance. And then again, to ensure that telehealth services comply with regulations during a disaster. A lot of times there are special things done to help open up some of these opportunities during a disaster, but making sure you're working with the local people to make sure of what's available to you and not. So again, collaborate with the health agencies, hospitals, emergency services to identify the areas that are most impacted and where those services need to go. So go ahead to the next slide. So after you've sort of identified like what you're going to set up, kind of where and what needs to be out there, the infrastructure set of it is super important. So determining the platform that you're going to use, and that really needs to be done prior to the emergency. If you're having the emergency, it is not time to decide whether you're going to use Zoom or DoxyMe. Or any of those platforms to provide these services. So you really have to have that relationship and the contracts in place prior to the event to make it simple and streamlined. And hopefully you're going to be using a platform that is familiar with a lot of your users already so that you're not recreating the wheel. So if you've been using Zoom as part of your kind of virtual platforms, as you progress into this, it makes a lot of sense to try to use a platform that a lot of people are familiar with. And fortunately, things like Zoom have become very popular during COVID. So a lot of people have a lot of experience using those types of platforms. Establish the communication infrastructure. So set up a resilient network, and that may be to contact those local companies like Verizon to have them bring in additional support, as well as working with people like Starlink in the community just to set up that connectivity. And then deploying any medical devices to support these consultations that are out there, and getting them out to the right place. If you're working with patients that you're trying to keep in your home as remote patient monitoring, you may have to have some way to get some of those devices out to the patients so for follow-up care, but as well getting them out to the actual clinic locations that you may be setting up. So if you've identified a school as a community center that you're going to be setting up, and then getting this equipment into those places, and then further getting the people at the location trained and able to use it. And then something else a lot of times that is not thought about, if you are sending devices out to the patient homes or dealing with them in the clinic, we do think about the cleaning of a lot of this equipment if we're working in the medical environments. But one thing, if you're working with patients out in the field, making sure you have a plan if you're sending mobile devices and different types of equipment out to patients, that you have a mechanism to clean those devices and get them ready if you're going to be bringing them back and sending them out to other community members. So again, just planning for the infrastructure and like what you're going to be using and getting those devices out. Another crucial phase of kind of being ready and then responding during the face of a medical or a climate emergency. All right, you can go ahead to the next slide. So the next phase of this is that launch and operations. So everything from enrolling the patients and the triage, how are you going to be enrolling those? What's going to be the service? If you're kind of attaching to a clinic that's already in the space, you may be able to utilize their EHR. If you have hospitals that are attached, something like UVA, we use MyChart to communicate with a lot of our patients, but you have to have a clear mechanism for enrolling the patients and sort of keeping track of who you're working with during this. And so again, a lot of forethought has to be in place as to what you're going to use, and then getting the training for any additional volunteers and providers to be ready to use that system as you're rolling it out. Healthcare provider assessments, as I spoke a few minutes ago about what's happening down in North Carolina, having a way to communicate and get volunteers in place, and just clearly being able to identify the needs that are in your community. And so that might involve meetings within the community to discuss sort of what's happening. And if you have like a large need for people to have like psychiatric support and things like that during the, for PTSD, and you just have to have that plan in place and have those providers identified, and then a mechanism to get them scheduled and in front of the patients. And so, and again, if you had, as we've said many times, if you wait until the disaster to try to get that in place, it's a complicated procedure. I do think they've built some of the things down in North Carolina pretty like after the event, but there's a lot of resources now about, to help with some of the scheduling and stuff that's out there. So, reaching out and finding a way to organize and get that information. All right, go ahead to the next slide. So the post-launch monitoring and support, so the monitoring the performance, continuously evaluate the effectiveness of the telehealth services. If something's not working, being able to identify what's happening with it, track the number of consults, the outcomes, gather feedback from the patients and the providers. I mean, I think that's crucial. And anytime you're using telehealth services, you really want to hear from the users out there if it's working and if it's not, if the technology is a burden, and ways that you can improve that service. You have to set up a response team to help to be able to receive that information. So having a mechanism for people to give that feedback back to you, then having a group of people that are actually like listening and reading that feedback and responding to it, and then potentially having a communication channel where you're responding and pushing information back out to the community as you're making changes and to the program and trying to identify their needs. To address the privacy and security, this is always important when you're dealing with the telehealth platforms, and it's easy to start to throw a lot of this stuff together in a hurry, after an emergency, but making sure you have the data encryption in place. And so a lot of that comes along with, if you're using Zoom and having you have a BAA, a business agreement, a business associate agreement with Zoom. The software automatically does encrypt the video, but making sure all that stuff is in place, that you have the data encryption in place for your video, as well as any sort of EHR that you have out there. So if you have information about the patients, making sure that's stored in the proper location. You can't just decide to turn on like Word and start typing information on a patient. That's not the great way to basically keep that patient information. So you have to have a clear mechanism to secure that data. During an emergency, a lot of people use a lot of different tools, but making sure you have a plan in place for privacy and security. Providing ongoing training and support. So as I spoke earlier, it's a great idea to use a tool that you're familiar with and that your users are familiar with, so that you don't have something that takes a lot of learning to get ready to use it. We've spoke about Zoom a lot, and during the pandemic that we've just gone through, a lot of people are now very familiar with it. And so if you're using a platform like that, you do find that a lot of users are pretty competent and capable of using that. The other pieces around the edge of that need to make sure that folks are familiar with is if you decide to do like remote patient monitoring or any of that where you're using our other peripheral devices, there's a certain amount of training that will have to go into sort of interfacing with those devices. And it's making that decision on everything, whether you're doing a full virtual exam with those Bluetooth devices, or you're just basically capturing information that's coming off of them. And so that sort of changes the way that you support those devices, as well as the security and privacy concerns. If it's something that you're just visually looking at some numbers and things like that, that's not something that you're saving data. But if you have data that's being saved off of those devices, you have to make sure that they are in compliance with HIPAA. And again, making sure that you're training all of your providers and everybody how to use them and keep those devices secure, and that they're not accidentally sharing information that you didn't mean to share across the platform. All right, and go ahead to the next. So that's basically sort of going through standing up this clinic in your community. and sort of some of the resources that you need to pull together, around you in the environment. So I think that's, as long as you think through and have this communication plan in place, have your tools ready, the battery backups, the internet connections, and then you have a thoughtful plan on how you're going to utilize these telehealth services, everything from sort of identifying the area of community you're going to set it up in, getting the hardware in place and planning. I think it offers a lot of opportunities to help support a community out there.
Thanks, Brian. I think one thing I would love for you to chat a little bit more about is just some examples of when you have done some of the preparedness work. Like, who were the people that you had to talk to and coordinate with? How did you, even test the equipment in the field before an emergency? I think you have a lot of experience to share on that one.
Yeah, that's a great question. And I should have probably railed into that as I was talking, but thank you for taking the time to ask that. And I do think, so some of the things that we've done in advance is one, setting up a group, like a monthly testing regimen, and we identify community partners, and whether that's the fire department, the police department, the other hospitals in your area that you may be working with, community clinics and things that are in your area. So identifying those partners. And again, as we spoke of identifying the platform, some of the things that we did at UVA, a couple of them were around some community events, around some things that were happening around Charlottesville. And what we had stood up was this main communication center here at UVA that had a lot of our leadership, and it was tapped in via video conferencing to the fire department, to the police department, to other areas of UVA, to other areas of the hospital that were impacted by these different things that were happening. And so it was a real-time communication mechanism. When something was happening, they could basically stand that up and put out real-time communication to the group. Not only was it super important to have that command structure in place so that we knew who was in charge and who was going to be operating and running these services as we sort of moved into operationalizing the system. So having that clear plan in place as to who was in charge and making those decisions as you go into it, but really how you work together with all these organizations in the community. And so what we saw was when an update needed to go out, and say that there was a nurse up on the floor that was hearing these updates, it was almost like they were just reaching out to get that information, because when you're involved with an emergency, everybody is, so anxious. And so by having these systems in place and a clear way to get information to the users and the people that are providing services, so that it helps sort of eliminate some of that fear in the environment, that's happening when something happens. Because when you're at a sense of political unrest or when resources are not there, people get very anxious. And so what I really found is just having that sort of cross communication between the different folks. And so it goes back to having that plan in place, and then understanding what types of communications are going to be going out. I think when you're talking about schools and, you have everything from the initial, early dismissal and when school is going to be closed, but having that plan and, being able to send out that information to all of the students and parents to keep them abreast of what's happening in the community. Some of the other things, when we're doing stuff at, say, at some of the bigger events, and some of the events that we've supported are 30 to 40,000 people, and so this is almost the same size as some of the communities that we've talked about in some of the more rural areas. And having that triage tent in place, and we were able to provide all kinds of services. But a lot of times it's the bigger challenge is finding the providers in your community that are going to be available during that event. And that's always been the bigger challenge for us, is the technology a lot of times is not hard to set up, but finding the people out there on either end of that that will be there to basically respond to it. And so if it's going to be emergency services, having those physicians and providers identified in advance, so when you do stand this up, you have a core team that you can go to that can provide those. And whether that's back to the emergency room at the hospital, and some of the events, that's what we had, was a direct line back. So if patients showed up at the triage tent at the event, they could then see the emergency department doctors, and it could make a determination if they actually needed to be transported to the hospital or if they could be triaged at the location. So it really added a lot of intel and information out in the field, and that information sharing back and forth between the doctors and what was happening out at the event. And so the same thing, if you have a community that has been impacted greatly, you may have that triage area set up, and whether that's at a school or a tent, and then you have that connectivity back to a hospital where you have providers that could then help you determine if you need to transport patients, they can stay where they are. And even to the point of if during an event like this, you may have, if they actually open the school back up because you want your students to sort of have that sense of normality, being able to offer some of these telemedicine services as a triage to the students to keep them at school. So you could, have primary care appointments that to rule things out, to try to keep them in class so that they don't have to then go back home if they're there during an event. So having these telehealth services during a climate emergency that could be available to keep kids at school or to see the kids and help triage them when they're at home. So if they have a lot of stress in the community. So.
And what have been your experiences with mobile deployment to like different telehealth access points or, lessons learned regarding like battery backups and solar power and all of other things?
And that's been in a lot of conversations even here in the last couple of weeks. I was having some conversations around some of the solar batteries and whatnot that are out there. We've really done a lot more focusing recently on utilizing Starlink, and mostly because the satellite internet, if you do have an outage, it seems to be more stable in the kind of grand scheme of things. And from my perspective, I like the idea of being able to get the same system out. So if you're building digital navigators that are going to be providing services to your patients during an event like this, identifying a service that's sort of the same across all the deployments. And so if you're having to, a lot of times when we're trying to do mobile deployments to see people in their homes, you have different providers that cover different areas. You might have one person that lives in a Verizon area. You have another person that lives in an area that's supported by AT&T. And where that becomes challenging, if you're trying to provide services that you're supplying the internet for, with having a lot of different companies that you have to work with, that's quite challenging. And we just did some drive testing here recently to deploy iPads in homes, and we had 5 users. And I think we had 3 different carriers that supported those 5 users. And that becomes immensely challenging trying to support that and manage all those different accounts. But if you utilize something like a satellite-based internet, the low orbit like Starlink, it really does streamline those capabilities. And so we found that, using something like that, and they have some new services that are more backpack enabled. So they're smaller services now, and they're a little less expensive than some of the bigger antennas, but I think the cost is still a challenge with some of those solutions. I think it's $700 for the baseline antenna, and then it's like $100 a month for the service. So we're not talking like something that's super cheap. But moving to the battery side of things, in the last few years with some of the improvements in batteries, we're starting to see a lot of something called solar generators, and we really have focused in on those. There's a lot of different models out there these days. Goal Zero is a company that I've done a lot of work with, and they have a couple of units right now. And I think some of the big important things to look at is if you're trying to provide battery services, you need to think about what all you're going to be plugging into it. If this is something at a patient's house, you're talking about a pretty compact system. So it's really just maybe a device and a small battery. But if you're talking about setting up a clinic, you're going to need a lot of power. And power is one of those things, once you're out, typically during an event. They do have some of the solar batteries now that one of the biggest things is how fast the battery recovers. And are you going to be using it? Because a lot of times you're going to be doing those telehealth services during the daytime. So during you're going to be trying to run your clinic when the sun's up, when you would actually be charging those batteries. And so you need to think through how long it takes to charge the batteries. One of the solutions we've been looking at now, at about $1,000, I think it's like a 12 to 14 hour recharge time. At about $2,000, they have a unit that gives you about a 4 to 6 hour recharge time. If you have basically you can recharge that battery in 4 to 6 hours and then have a second battery potentially there with it. And you would have continuous 24 hours of coverage and the ability to recharge those batteries during a single day cycle. So thinking about how long it takes to recover your power, and then how much power you're going to need. And they have a lot of information out there on the websites as far as getting these sort of battery backups. And even to the point, if you were permanently wiring this into a clinic, they have the ability, some levels of batteries that can support that whole clinic for several days. And so really identifying everything you're going to plug into it. And, prior to the event, so that's going through all of the devices you're going to use, the internet, the computer, looking at their power consumption and then having a reasonable guess as to what you're going to need to run and how long you think you're going to be down. And so to keep that operational. So.
Yeah, thank you very much. Now, I think one of the things that I cannot emphasize more or enough is that we don't do well enough to prepare for emergencies. We are usually knee-jerk reaction, trying to respond to and react to things when they happen our way. And so as we really think about climate change, it is something that we know, this is going to happen more and more frequently, and they will be more and more severe. And so this is the time, and there actually are some great grant funds now becoming available to help people prepare for climate change emergencies. And so for those of us in healthcare, we usually don't look at EPA grants. We don't usually look at emergency preparedness grants, but this is probably a really good time to start pulling in some of those funds, because the best thing you can do really is to think through and to engage some experts to really think through what would happen if. And like one of the interesting things we've heard on the news is, people who are living near the coastal regions are always prepared for hurricanes. But people in Asheville, North Carolina were not prepared for hurricanes because they really didn't think it would affect them. And so, I think we need to really take that stance of it can affect anyone at any time. And being prepared is certainly much better than not be prepared. And so, when disaster strikes, the time to prepare has passed. So let's really think through some of these things now before those disasters strike. So next slide is just our contact information, and we are happy to take some questions.
Thank you so much, Kathy and Brian, for that very insightful content. Really hitting home with some really great gems there about being prepared before disaster strikes. So whether you are already doing telehealth or whether you're looking at implementing telehealth in cases of crisis, I think there was a lot of really great takeaways in today's webinar. We do have a few questions that came through in the chat and Q&A. First one I will direct to Brian. So speaking about Starlink, how well does it work in areas that Verizon has a weak signal?
So that's a great question. So from my perspective, Starlink works just about everywhere. One of the bigger challenges, I think, is just making sure that the area is not oversaturated. But typically during a climate emergency, so far, Starlink has actually responded pretty well of being able to turn up the bandwidth in those spaces. But truly, it's a low orbit satellite solution, and where you're tied to the towers for any of the cell type communications. So Verizon's very much, you're tied to your location to the towers and like what capacity those towers have. So whether or not it's LTE or 5G, 5G is obviously a lot more robust, but 5G doesn't go as far as the LTE connection. So a lot of times if you're in a market that has 5G, you may see that you're not quite getting, you can't get as far away from those towers and use them. LTE typically will work a little further out, but typically doesn't give you that throughput that 5G does. But what Starlink really does is sort of take away the geographic issue altogether. The bigger challenge with Starlink may be that if you're in the middle of a storm itself, that it sometimes has trouble talking to the satellites. I had it at my house for a couple of years, or for a little over a year. And sometimes when a big storm would happen, you would lose internet for a few minutes while that storm passed. And it's basically the cloud cover blocking your ability to talk to the antennas, the satellites flying over. But as long as you have a clear shot to the sky, what we find is that actually makes it's a very solid solution that you don't have to sort of go in and do these assessments at each location. You can pretty much be confident that that's going to work no matter where you deploy it. So we do highly recommend it. It's just a cost prohibitive right now. I think for cell coverage, most of the time it's somewhere around $50 a month for some of the unlimited plans if you're using the Verizon First Responder or the AT&T FirstNet. And the cost of Starlink is probably $100 a month. And then the devices itself are pretty expensive. So there's a high cost associated with it, but it's a great platform if you can get funding for it.
Thanks, Brian. Another question, any thoughts about AI transcription services incorporated through Zoom or other apps?
Somebody's been listening to some of my other conversations out there. No, the AI transcription services, and depending on your school of thought, I do think that some of these offer a lot of value. There's some concern that this is taking away some of the opportunity that medical students have to sort of get into the industry. They do a lot of scribing, and that's always been a hot topic as we start talking about scribe services. But the idea that a service can listen to every word of a conversation and then record that and put it into the notes is pretty fantastic. Because you as a doctor may not hear everything that patient says. You try to be very good at it, but there could be some things that are not captured. And by using some of these services, I mean, I think it really does allow for some very robust note taking. But just a couple of things to sort of think about that sort of came up in some of the conversations we've been having about that. When you're doing a transcription like that, that is actually a verbal, like a written transcription as it does it. So like if you have Zoom or one of these solutions that transcribes your meeting, it is actually typing out every word that is said during that event. And something that came up in one of the recent discussions around this is the fact of if that's discoverable or not around AI. And I think that's going to be interesting as it sort of like fleshes out as in the courts. Because as AI generates a lot of the tools that are out there, it has to generate a transcription that then a lot of places don't save that transcription. So I'm kind of interested to see how these scribing services work as far as that sort of recording data and making sure that they have everything saved that's in place. You know, Zoom is no small company, so I think they'll be, you know, planning through a lot of this, but I'm very interested to see how that goes.
Okay, another question. What is the most common chief complaint you receive for telehealth in these disaster situations?
Yeah, you know, for me, I think it's that connectivity. So the fact that, you know, when you need the service to work, if the bandwidth's not there, so that's always been a big challenge of making sure you have that connection available when you're trying to provide the services. From the provider side, I think to make sure that the training is in place, like, you know, making sure they have access to the tools and they know how to use them. A lot of times people sort of get thrown into these things when it's a disaster, you know, when in response to an emergency. So there was no forethought into making sure that that training's ready for folks. And so I think that's a big part of it, making sure your providers are ready, as well as the support if something's not working, like who do you call for help, you know, like, you know, from the patient perspective and the provider side. A lot of times we think through pretty well if a provider has a technical challenge, who they call, but who does the patient call if they're having a challenge? And so that's a lot of times a tricky, you know, piece to try to get patient support, because then also a lot of times you're dealing with patient devices out there. And so that's always a challenge when you're dealing with patients and their personal sort of hardware. But understanding kind of what you're, you know, that's always the challenge for me is support and then the training to make sure people are ready and then bandwidth.
And one thing I would want to emphasize is that Brian mentioned the testing piece. And I was part of a number of emergency preparedness efforts in the health department way back when. And one of the things that we learned was that, you know, if you don't test regularly, things get outdated. So you might have everything in place. You ran one test and then 6 months later, you haven't touched the equipment. Nobody's, you know, you have turnover. So the training has been lost. You have software updates that don't get updated on these equipment that might be just sitting in someone's closet. And so, you know, in the middle of emergency is not the time, you know, when you're working on a backup battery to start updating all your software on the equipment. So, you know, these are all things that you really need to think about. So, you know, how some places test emergency kind of setups every month, others do it every quarter. But however you do it, you really need to think through the frequency and what that impact might be in the event of an emergency.
Yeah, and that's one of the things we did. We had a Northwest region group that we had set up, and we had a monthly testing regimen that we went through. And so basically every month we basically stood up the meeting and everybody would join and we would make sure that the systems were operational. And typically that was the command centers from the different institutions that we were working with would basically every month like log on and take a quick test. And we typically tried to track that testing. You know, unfortunately, you do run into the fact of that, you know, not everybody comes on and like does the testing when, you know, every month, but, you know, basically having that in place and then tracking that testing and reaching out to those users to try to get them to join that testing, because that does help eliminate that, you know, waited 6 months and you go to try to use something. And you guys have probably all used Zoom when you go to try to join a meeting and it says your application now has to be updated before you can join this meeting. And, you know, if that's happening during a climate emergency, or during a time when you're trying to use a system like this, it gets pretty frustrating, especially at the point of that clinical deployment. If you're trying to see a patient to provide some sort of clinical services and then all of a sudden everything goes bonked out, and it's not working, it can mess up schedules, especially if you have tight schedules around clinics and whatnot, that you've set up. So, making sure that equipment's ready at the time of the need. So.
And I think the other thing that we talked about was the relationships that you develop. And so, at the time of emergency is not the time to start reaching out to your AT&T and Verizon and to see who you can talk to about, getting something set up, having those established relationships. And that's another one where you maintain those connections. So you might have established something, a year ago, but if you haven't talked to this person, well, we all know turnover is happening industry-wide, and at the emergency, when you try to call that person's number and they're not there anymore, and now you have to go through, 6 to 7 transfers to figure out the right person to talk to, that's not a really good time to do that. So again, keeping those relationships established and in a continuous relationship mode is really important for emergency preparedness.
Speaking of relationships, so when I think about, the aftermath of a natural disaster, I often think about the mental health effects that happen within the community. So as far as relationship building, what are providers, primarily like telehealth medical providers, like what can they do to ensure that mental health is being supported and offered to the community after a disaster?
Yeah, I would say, and Brian probably has some thoughts on as well, but I would say, first of all, make sure you know who the providers are, who can provide those services. And a lot of times in a disaster, you don't need to have a psychiatrist or a psychologist. Sometimes it's the peer support, peer recovery kind of specialist. You need your substance use and abuse specialist on board, because that's when people they're stressed and people use substances during that time. But a lot of times it's just connecting people with family support. So during an emergency, people are very often isolated because they might be stuck in their own homes and they can't get out because the roads are closed, and so being able to have some mechanism where someone can even connect to a family member often helps. And so we have seen people really thinking about, like, how do you even connect people? If you're an older person, let's say you're in your 80s and your only support is, your son or daughter who's in 2 states away, and you've now lost power, you have no internet connection. How is this, older individual who's now stuck in their home going to connect with somebody who they need to have for that social support? And having a site, like whether it's your tent or whether it's your school gym, where it could be kind of a family connection point, is also a really good way to deal with some of the mental health issues.
Yeah, and that's one of the things for us. A lot of times it was having that resource for families to come to, so a location that they can either come to and use as a resource to sort of rest and be safe in the environment. You can offer connectivity to that, into that space. And so that's one of the things that we do here. A lot of times is there's a family area that gets set up sort of separate from everything else, that's away from what's happening around some of the patient care, so that there's sort of this separation of services, but having that resource available. And one of the things we talked about is working with Verizon and AT&T and the potential of bringing a mobile hotspot in, and not like a mobile MiFi, but one of these tractor trailers that come in and they can provide services. And so literally you could, if it gets positioned correctly in a community, you could offer services to a lot of people through that. But again, or identifying a space that you set up as a location that people can come to. One of the things during the pandemic we did a lot was to help folks deploy Wi-Fi around their parking lots, so people could come up and do telemedicine encounters from the outside of a doctor's office. And libraries offer some of this service sometimes. So really having those areas identified that people can also get connectivity within the community, to reach back and talk to providers as well. So.
And again, that's a communication piece. So having those plans, and I'm going to keep emphasizing having those plans in place is really important, but communicating to being able to have enough in place so that you can communicate to your community. If the power goes down for more than 24 hours or 48 hours, this school is going to be, a family, we'll have a family tent and you can connect with family members at that time. Because one of the things that people panic about is they're trying to reach their family members, but the cell towers are down, so the phones aren't working. People don't have landlines anymore and internet is down. So, they don't have a way to communicate that way. And just to alleviate some of that stress, if they can go to a place and connect their phone or connect to a hotspot, and talk to, mom or daughter or whoever, that is a big piece for the mental health component.
Thank you, Kathy, and thank you, Brian, for answering all of our questions. If there are any more questions, feel free to email either one of our presenters. Their information will be shared along with the recording and slides after today's presentation. With that, we're going to move forward. So we are very excited to continue this conversation on telehealth preparedness and opportunities to leverage telehealth, specifically in managing outbreaks within schools. So we invite you all to join us again in about 3 weeks on Thursday, November 21st from 2 p.m. to 3 p.m. Eastern Time. We will be sharing that registration link in the chat shortly, as well as in the follow-up email. And we will be joined again by Brian and Kathy. Do you want to let us know a little bit of a teaser of what to expect?
Yeah, so we're really going to be looking at everything from the simple stuff, the COVID, the measles, the mumps. And as we are approaching this time where there's a lot of vaccination hesitancy, we're already hearing in the news, that there's been a recurrence of polio, there's that TB outbreaks are becoming more and more common. And so I think it is something that we're going to need to really think about. And maybe Brian can give a little teaser about some of the work he's done with Ebola.
Yeah, so I started working in a lot of this isolation, the outbreak stuff back during Ebola. And it was an interesting kind of the way that we got into it at UVA. But we started off talking with some of the folks about what was happening in Africa. And then all of a sudden we were having this sort of outbreak in the US. And so we started to stand up systems to sort of manage patients in their spaces, whether that was connecting them to their family, deeper connections to the providers, utilizing telehealth equipment for isolation, to be able to communicate with those patients in isolation, not having to don and doff every time you have to have a conversation with the patients. So what we really looked at was leveraging these telehealth services and technologies to keep patients in isolation, talk to them in isolation, and then using these systems to keep our providers safe, whether that's monitoring the donning and doffing, and just being able to talk in and out of those communication or those isolation zones. We've even got the Mars outbreak now, so we're back looking at what the same systems that we used for Ebola now. So it's really a poignant time that we're back talking about this. And we really started with this with a couple of systems for Ebola, and then we stood up for COVID because of it's not the same type of isolation, but still it's important to sort of mitigate the infection. And so utilizing these systems to do all that. So we look forward to this opportunity to sort of spell that out and how we've utilized systems to provide those services.
So if it sounds interesting, please come back and join us for another exciting webinar to learn how to leverage telehealth in various ways. Moving on. Whether you're a longtime advocate of student health or you are just now discovering about the impact of school-based health centers, particularly school-based health care, we invite you to join us at our 2025 National School-Based Healthcare Conference. Save the date and join us in Washington, D.C. from June 29th through July 1st, 2025. And you can visit our website, www.svh4all, for more information. And for all you health center staff on the call today, we want to hear your voices. Tell us about what training and professional development support you and your health center staff need to best support your community through the 2024 National Health Center Training and Technical Assistant Needs Assessment. It is available in English and Spanish, and it closes tomorrow, so it's not too late to complete that. Feel free to scan that QR code on your screen, and we will drop that link in the chat shortly. And then lastly, please stay connected with us. So if you want to learn more about SBHA and all of the great opportunities and resources that we have, feel free to follow our digest and also follow us on our social medias.
And before we close out today, I mentioned at the beginning we had a quick evaluation. So thank you for those of you who have stayed. I'm going to launch that now. If you could just take the last few minutes, just go through those questions. And like I said, it really helps us hear your voices and hear how we can best support you. So I've launched those questions now. Please just take a moment, especially with those first 3 questions. The other 2 are open-ended. Please feel free to share your information. And as Gone said, we will be sharing all of these links with our resources, along with the contact information of our speakers today, the slides and the recording in the follow-up email and on the School-Based Health Alliance website. So thank you very much. Please take some time to complete the evaluation. And we were so happy to have everyone attend today.
Thank you.
Thanks all.
Thank you.
And also, if anyone has any follow-up questions or anything else that they think of, please feel free to reach out to us. We'll be happy to get you that information. Thank you so much, everyone. Keep completing those evaluation questions. We really appreciate it. So we'll be here for another few minutes just in case someone thinks of a last-minute question or there's something that comes up. Thank you, Gone. I think that's everything. Everyone have a great day. Bye, everyone.
Thanks, everyone.